Thank you and good afternoon. Just to start off with today, we've been having, as we noted in our statement, some challenges with the data system that we put into place early in this year in terms of our daily case counts. And over the past 7 days, this data system has been system issue has been resolved. And over the last 7 days, there's been an additional 254 cases that needed to be counted in the system, and those will be reconciled on the BC CDC dashboard by later today. So if you notice a discrepancy, for those who follow those numbers, that is what it is due to. And so for today, there are an additional 438 new cases, including 9 epidemiologically linked cases in the last 24 hours. So that does not include the 254 cases over the last 7 days. But that does bring our total up to 81,367 people in BC who've been diagnosed with COVID-19. And for today, that includes 137 people in Vancouver Coastal Health, 249 in Fraser Health Authority, 19 people on the Vancouver Island Health Authority area, 16 people in Interior Health, and 17 people in the Northern Health Region. We now have 4,679 active cases across the province and 243 people in hospital, 63 of whom are in intensive care. We have 8,445 people under active public health monitoring, but 75,255 people have now recovered. In the last 24 hours, we have had 2 additional people who have died from COVID-19, bringing the total number of people who've died in our province to 1,365. As always, we do think of the families and the caregivers and the communities who will be mourning these 2 more people who've died in this pandemic. We have 2 new healthcare outbreaks, one at the Chartwell Carrington House retirement residence and independent living residence, and another acute care hospital at the Eagle Ridge Hospital, one ward there. And the Eden Gardens outbreak has been declared over. We now have 8 active outbreaks in long-term care or assisted living and 8 in acute care settings. Of the people in long-term care, that includes 293 residents and 156 staff who are affected. In terms of the variants of concern, an update on those, we have 22 new confirmed cases, bringing our total number of people with variant infections of COVID-19 to 182, 8 of which are now active cases. The remaining people have resolved or are no longer infectious. And right now that includes 159 people with the B117, the one that we're most concerned about, increased transmissibility, and 23 with the B1351, or the one that's associated with South Africa. The majority remain in the in the Fraser Health Region, 124, and 50 in the Vancouver Coastal Health Region, and there are no increases in the numbers in other health areas. 9 cases overall have been hospitalized, but only 1 person is currently in hospital. And we know that we pay close attention to these cases to try and determine where and how people were infected. About 13% are directly related to travel, and 60% are close contacts. But there are still 20 to 25%, a quarter of these cases, where we are not clear where they acquired the source. And that reflects that we have transmission going on in communities, particularly, as we know, in the Lower Mainland. Since the start of our immunization program in December, we now have delivered over 283,182 doses of a COVID-19 vaccine, 86,537 second doses as of yesterday. And as you know, we have now made the determination that we will be extending the dose interval between a first and second dose starting today, and that extension will be up to 4 months. Yesterday, as you know, we've reported on, we've begun phase 2 of our COVID-19 immunization program that will, in the next month, see over 400,000 people in British Columbia immunized. And this is an incredibly important next step in our program. This continues to focus as well, particularly this week and next week, on our high priority, higher risk individuals and groups. And then our first broad age-based population group, those most at risk, are seniors and elders 80 years of age and above. As you know, this pandemic has taught us a lot. We continue to learn about the virus, about how it's transmitted, and to review and adapt our approach based on scientific evidence and real-world data. So what we see from trials, from studies, and then what we actually experience in the real world. And we also, what has underpinned our immunization program, where our experience in communities here in BC that reflects what we're seeing around the world clearly shows us that the older you are, the higher your risk of having more severe illness or dying. We've also learned that outside of the lab, on the ground and real world, the initial dose of the approved vaccines that we have here in Canada are highly effective. Our goals, as I talked about yesterday, have always been to reduce morbidity and mortality, so to reduce sickness and death from COVID-19, to protect our healthcare system so that we can provide those necessary services to everybody who needs healthcare, and while doing that, to minimize as much as we can the disruption that this pandemic has made on our community and our society. The vaccine strategy that we have approached, or that we are taking, is the one that maximizes the greatest benefit to our whole community. And in our context right now in Canada and BC of our limited supply, as cases continue to increase and we have transmission and outbreaks in our community, our focus is on maximizing the number of people who are benefiting from that very high real-world protection that we are seeing from a first dose of vaccine in BC. This new data that we have been following very carefully since the immunization program started around the world shows that we have sustained high levels of protection against illness, hospitalization, and deaths from one dose of the 3 approved and effective vaccines. We are following the science of vaccines. We have been following vaccine efficacy, and that's what we get from the clinical trials that are done under specific controlled conditions. So we know that anybody with certain conditions are ruled out, are not included in those trials. Those trials were also using an interval that maximized our ability to get the information about whether these vaccines worked and were safe as quickly as possible. And that's why they used as short an interval as they could possibly use, in most cases 3 to 4 weeks. We also use the science of immunology, how our body's immune system adapts and uses and responds to vaccines. And this is a field of study that we have had for many, many years, and we have a lot of experience from other vaccine programs. And we know that it takes time for our body to develop antibodies and for our cell-mediated immunity, the second part of our immune system, to be stimulated and active so it can respond if you're exposed to a virus. We also now have started and are using the data that we get from what we call effectiveness. So efficacy is that trials, the clinical trials where everything is very rigidly controlled, and effectiveness is the real world experience of what we're seeing when we use these vaccines in people in the real world. And we have been, from the very beginning, we have a great team of scientists at the BC CDC who have been doing this this for many years in terms of influenza, looking at pertussis, all of the immunization programs that we have, and understanding the vaccine effectiveness. How well do these vaccines work in our populations in BC, in Canada? And that's led by Dr. Danuta Skowronski at the BC CDC and her team, and Dr. Monica Naus. And we have a lot of experience in this. And from the very beginning of our COVID vaccine immunization programs, we put in those studies, those real-world population studies, to understand the effect of these vaccines in our community. And we focused on the people most at risk in long-term care and healthcare workers. And that data tells us that the effect that we're getting, the benefit and the protection from a single dose after about 3 weeks, is upwards of 90%. And that lasts for a long time, at least for several months. So that is the type of information that we need to make those important decisions about what is the best way to maximize benefit. Plus, we add in data modeling, which helps us understand who to immunize first and when's the optimal time to have a second dose, given the vaccine supplies that we are receiving over the next 4 to 6 months. And we've used the basics of what we call immunology, the body's immune system response, and vaccine science. And that is why I am so confident that the decision we made over this past weekend to extend that interval is the best one, based on all of the science and the data that we have, to maximize the benefit to everybody in our community here in BC, so that we can both stop people from getting seriously ill, prevent people from needing hospitalization, and prevent people from dying, as well as getting well on our way to being able to reduce this disruptive restrictions that we have to put in place to prevent transmission of the virus in the near term. So we are now looking at months rather than many, many months before we can reach a level where people have enough protection. And the other part that we need to remember is that for everybody who's immunized, for the more people we have immunized in our community, the less probability that the virus has find somebody it can transmit to and pass on. And that protects all of us. So it magnifies the effect of an individual protection. And we know the positive impact of this goes further than even every individual that's vaccinated. So we know that the risk of passing the virus on to others is dramatically decreased. So it's added protection to all of us, to our communities, our families, and everybody that we're around. And this is what we call a vaccine multiplier effect. And we know now, with the newly approved AstraZeneca Serum Institute of India viral vector vaccines, that we have yet another safe and effective vaccine that will help us accelerate that effect by providing vaccines for, we're looking at essential workers and frontline first responders. While we don't know yet what our supply will be, this means that we can move everybody up the line, and we can provide protection to those in our community who have shown up for work every day throughout this pandemic, and we can protect them, their workplaces, their families, and their communities. This is encouraging news for all of us. There is light ahead, and it is getting brighter every day. But we are not yet there, and we need to remember that particularly now, as we're ramping up this program, we need to continue our levels of protection and not put aside those public health restrictions quite yet. We have to have the confidence that we are slowing the spread in a sustained way to stop easing our restrictions. But with this rapidly increasing number of people being immunized, that is going to happen sooner. And that means we can reduce those restrictions and increase visits in long-term care much sooner. And we can increase our social interactions sooner. Those are the things that are going to be important. We now know from the real-world data that we don't need to rely on second doses before we can lift some of these restrictions if we have enough people protected and we can stop that transmission in our communities. So that is our goal right now. And when by the time we get to the end of June, July, where we have everybody protected with a single dose, we will know more about when is the optimal timing for a booster dose. Do we need a booster dose that will help us deal with some of the variants that we're seeing in other parts of the world? All of that science is going on now. And by the time we get through these next few months, we'll have a better idea about that, about what we need to get us through the next respiratory season and the next few years. But right now, we know that maximizing the benefit of a single dose for more people in British Columbia is going to get us to our post-pandemic goal sooner, and is going to protect more people, keep more people from needing hospitalizations, and prevent more people from dying. This means right now we need to stay committed to using our layers of protection, to stay small, stay local, and remember to continue to be kind, be calm, and be safe.